Hi, my name's Emily, and I'm going to be your physician assistant student today. What's your name?
Hi, my name is Nancy.
Oh, it's so nice to meet you, Nancy. And how old are you?
I am 65.
Okay, so when's your birthday?
March 3rd, 1954.
Okay. Okay, so I know that this is our first time meeting, so this might take a little bit longer than a usual checkup, but can you just tell me a little bit about why you came in today?
Yeah, I've been recently just feeling very bloated, and like I don't really have much of an appetite, which has been frustrating and not normal for me, so.
Okay, have you lost any weight? Or, because I know you said you're bloated, but you're also not eating as much, so.
Yeah, not really. I mean, I would love to lose more weight, but I mean, not as
Wouldn't we all, right?
Yeah.
Have your clothes been fitting any differently, or?
No, everything feels the same. I guess like when I feel bloated, like everything feels tighter, but like my weight really hasn't changed.
Right.
It's just that overall I feel that weight, you know?
Yeah, that totally makes sense. Can you tell me a little bit about how long this has been going on?
Yeah, I mean, I can't really pinpoint like an exact start date. I guess it's kind of been like an intermittent problem, but I'd say at least 6 months I've been feeling this way. I just kind of put it off for a while.
Okay, and do you notice that anything makes it worse or better, that feeling?
Not really. It just kind of comes and goes intermittently. You know, it's just like overall just that bloat. And I mean, I make myself eat, obviously. Like I need to still keep eating,
right,
but it's not like I want
good.
to. Yeah.
Well, I'm really glad that you're still making sure you get the right nutrients. Have you ever noticed that the bloating comes and goes at certain times, either of the day or when you're doing certain things?
No, I can't really pinpoint much about that. I wondered at first. I told myself it's related to diet, but I don't think it is. You know, I've tried monitoring and food journaling, and it doesn't seem that certain foods do anything.
Right.
So,
have you ever tried to cut anything out of your diet, thinking it was something?
No, first I like just did the food journaling to see like if I could find a correlation, but when I saw like it was just so random, I didn't bother cutting out food I wanted to eat, you know?
Yeah, so. I've been there. I've tried to food journal too. The other questions I have for you is, have you ever felt anything like this before? I know it's been coming and going for 6 months, but before those 6 months even started?
No, I've never felt this way before, aside from, bloating related to food, like maybe I've felt that before, but never anything like this.
Right. And then do you have any pain with this, or is it just uncomfortable feeling?
I think it's just uncomfortable, the feeling like in my abdomen, just that bloaty feeling. It's just like all in all not comfortable.
Right. And if you had to rate this on a scale of 1 to 10 with how much it affects your daily life, if you could try and give it a number, what would you give it?
I'd probably say between a 4 and a 5. It doesn't, it's not like pain, so it's not like keeping me from doing things. It's more so just annoying, and it's just a bother.
Right. And then does this feeling of, I know bloating can't really like move to any parts of your body, but the feeling of just not feeling good in general, does it ever radiate into other parts of your body?
No, not really. I mean, I feel fatigued.
Okay.
So I don't know if that counts, but all in all, just that bloating feeling, that fatigue, and
right.
Yeah.
And do you have any other symptoms associated with this bloating?
I don't know if it's associated. I mean, I am a retired nurse, so I think back to all that I used to see, and that can be scary, thinking too long about that stuff. But I mean, I feel like my eyes have been looking yellow a little bit, and I don't know. I could just be crazy. I don't know if that's related or not, but I have been noticing that. So.
Right. Okay. I don't think you're crazy. I think that everybody knows their own body, and I think it's really important to keep an eye out and look at your own body. So do not think you're crazy for noticing things. Okay. And then I just want to know, do you have any pertinent family history? So anybody who's been through something like this before that has complained about this feeling of bloatingness, or maybe a jaundicey yellow to them, anything like that?
Not that I know of. I tried to think through that already, and I can't think of anything else. So.
Right. And I know those are kind of, generalized symptoms, but just thought it might give us a hint to something.
Yeah, absolutely.
Are you on any medication currently?
I am. I'm taking lisinopril.
Okay.
I take that every day.
You do. Do you know the dose of that?
Yeah, it's 10 milligrams.
Okay. So do you have hypertension then?
Mm-hmm.
And you take it orally?
I do, yes.
Do you take it in the morning, at night?
Yeah, I take it every morning.
Morning, okay. And are those the only medications you're on?
I take ibuprofen I have some joint pain sometimes, so that just kind of takes the edge off.
Right. Have you ever been diagnosed with a joint pain disorder like arthritis or anything like that?
No, it's just an overall just like achiness. One doctor said it's probably arthralgia. Didn't really seem too, interested in it. So.
Right. How often would you say you take ibuprofen?
I'd say a couple of times a week.
Okay. And do you know the dose of that?
I usually do about 2 tablets of the 200 milligrams.
Okay. And then just sporadically when you feel you need it.
Yeah, just as needed.
Right. That makes total sense. And then do you take any vitamins or supplements or anything like that?
I do take a multivitamin, yeah.
Okay. Do you know what multivitamin you take or what it's called?
It's a one-a-days women 65 plus.
Okay.
Now that I'm 65.
How do you like being 65 and retired?
It's good. It's nice to have some downtime with the husband, and yeah, I mean, I thought I would miss my nursing practices, but I can still volunteer and stuff.
Yeah. Do you still try and get in? Where did you work as a nurse? Were you in the hospital?
Yeah, I was in a hospital.
So do you ever still visit the hospital and go volunteer or anything?
Sometimes, yeah. I like to, just like on a more low-key level. I think the pace of the hospital just got to be too much. But when you go as a volunteer, it's still nice to be there and just not as much pressure now that I'm old. So.
Right. Totally understand that. Do you have any allergies?
No, not that I know of.
No latex, no food allergies, no medication?
No.
Okay. Overall, how would you describe your health before this bloating? Like not considering the bloating or anything like that?
Overall, I'd say I've been pretty healthy. I mean, I have the hypertension, obviously. I mean, the joint pain's annoying, but I can't complain. Pretty healthy other than that.
Right. Have you have you been admitted into the hospital in the last 6 months?
No, not in quite a while.
Oh, good. I like to hear that. And just so I can keep this in our charts, are you married or single or widowed?
Yes, I am married.
Okay. To a man, a woman?
My husband. Mm-hmm.
How long have you guys been married?
Since 1977.
Oh, wow.
It's been a while. 42 years.
That's so awesome. How would you consider your relationship with him?
Oh, it's great. He's awesome.
Good. You feel safe with him?
Mm-hmm. He's a lot of fun.
Oh, what do you guys like to do for fun?
We like to go walking.
Yeah. Do you walk like around the block, or do you like to go on vacations and hike?
Yeah, we like walking, just in the woods, and sometimes we do like to travel now that we're both retired and we have time, so we're trying to plan some fun trips.
Yeah, sorry, so I wasn't recording for a second. No, that's so awesome. I'm glad that you guys, make the time to get to spend with just each other.
Yeah, absolutely.
I'm really glad to hear you're so happy in your health right now, but I just want to go through your past medical history.
Sure.
The first thing I want to talk about is your childhood health.
Mm-hmm.
So just overall as a child and an adolescent growing up, how would you consider your overall health?
I'd say it was pretty good. I mean, I had the chicken pox, but who didn't,
Right.
So I think I was like 7. Other than that, I think I was a pretty healthy child. No asthma or problems, really.
Good.
So.
Did you have any chronic childhood illnesses like measles, mumps, rubella, whooping cough, rheumatic fever, scarlet fever,
nope,
polio, or diphtheria?
Nope.
Okay. And you said that your adult health so far, you've had hypertension and maybe some I can't say it, and maybe some joint pain.
Yes.
But other than that, you're pretty healthy?
Yep. Other than that, I have been pretty good until all this bloating started, whatever that's about, yeah.
Okay. And then sometimes people forget that they have things, so I'm just going to run through a list of common adult illnesses, and can you just let me know if you have them?
Sure.
Any diabetes?
Nope.
Hypertension?
Yes.
Okay. Oh, duh. We've talked about that. Any hepatitis?
Nope, not that I know of.
HIV?
Nope.
Any COPD or asthma? I know you said you didn't have it as a child, but any thyroid disorders?
Nope.
Any coronary diseases?
Nope.
Any cancers? Any kidney diseases?
Nope.
And any blood clots?
Nope.
Okay, good. So you do seem like you're in an overall good health condition other than this bloating, which I know is probably so frustrating, especially because it's been going on for so long.
Yeah.
And I know you're probably wondering why I'm asking all these questions, but I think it's just really important to get an overall picture of health before I make a diagnosis.
Yeah.
And I want to make sure that we make the right decision together. And so I'm just going to ask you a couple more questions.
Yeah.
Have you ever been hospitalized before?
I was hospitalized when I had my son.
Okay.
That was about 40 years ago now.
Okay.
So yeah, there was that one, but no complications with that. That was fine. And then I was also hospitalized when I was a kid. I had a really bad car accident, and after that, I needed to be hospitalized. I think they did like a blood transfusion. And, yeah.
Do you know what year that was, or about how old you were when it occurred?
I was 11.
Okay.
So I guess 1965.
And you said that you needed a blood transfusion. Did you need any other surgeries or?
No, I mean, I don't remember. It was a while ago, but that's something I know that they told me I didn't need the blood transfusion. I don't think I needed any surgery or anything. So.
Oh, okay. Well, I'm glad to see that you're healthy and here today, even after that. Do you have any other surgical history not involved with the car accident?
No.
No, never even had your wisdom teeth out, anything like that?
No, I still got them.
Okay. That's why you're so smart.
I guess so.
And now we've talked a lot about your physical health, but I also think it's really important to talk about a patient's mental health. And I do this with all of my patients just so that, because it's so common in the United States, and I want to make sure that I'm focusing not just on the patient's problem, but the overall patient. So I'm just going to ask you a couple of questions about your psychiatric history. Have you ever been in previous contact with psychiatric services?
No.
Okay. Have you ever actually self-harmed or thought about self-harming? I know life gets really hard sometimes, but...
No, thankfully I've always been a pretty happy person.
Good. I'm really glad to hear that. And have you ever needed medical attention in general for any thoughts of self-harm or depression?
No, thankfully.
Okay. Moving on, I know this is kind of a weird switch, but I just want to talk a little bit more. I know you said you had a son. So, your son's 40 now, you said, just about?
Yep.
And how's he doing?
He's good. He's healthy. No grandkids yet, but...
Yeah. Do you want grandkids?
I would love grandkids, yeah. I'm hoping he gets on it soon. I know he's 40, but...
Yeah, but, everyone works at their own pace, and it's so different now. I feel like people are having kids later and later.
Yeah.
And so, just keep pushing it, but not too hard. And when was the first time that you ever had your period, if you remember?
Yes, I was 12 years old, so I guess 1966.
Okay. And
long time ago.
Yeah. And are you still having a period, or?
I'm not, no.
Thankfully
I got rid of that.
Yeah. So when did you go through menopause?
2005.
Okay.
It's a good year.
Yeah. Are you happy? You're happy to be done with that?
Yes.
So the date of your last menstrual period was in 2005. Have you had any post-menopausal bleeding?
Nope.
Good.
I left for good.
That's good to hear. And when you had your period, how would you describe it?
I was always pretty regular. Yeah, didn't struggle when we wanted to get pregnant, but I only wanted to do that once. So stopped after the one kid, and yeah.
No issues with cramping or anything like that?
No, can't complain.
Okay. And I know this may seem like a silly question to some people, but sometimes when people stop getting their period, they stop visiting an OBGYN. Do you still go see your gynecologist?
No, I haven't seen one in a long time.
Yeah. Did you stop after you went through menopause or after you had your kid? When's the last time? What year you probably went?
I feel like when I was working as a nurse, I was just always super busy. It was hard to be regular as is. And then when I hit menopause, I was just kind of like, I'm done with that,
You're right. It's hard. And so you probably haven't gone since 2004 or 5. When you were going regularly still, did you still have a pap smear every year?
I did, yeah. They started doing that.
And were they all regular?
Yeah, nothing irregular ever came up, so.
And have you ever had a history of STIs, any sexually transmitted infections or diseases?
No.
I know that you said you have been pregnant one time, and your son was a full-term baby who's still healthy?
Yes, he's in good health.
Good. And I know I could be wrong. Are you on any birth control, though, anymore? I know You're not
No.
Have you ever been on any birth control?
No.
Okay. And then, so when you had sex, how many partners have you had?
Just me and my husband for 42 years.
Wow. I hope that I can have a relationship like you can one day. And did you ever use any kind of contraception with him?
We just used condoms when we didn't want kids.
Right. Okay. And now I'm just going to go a little bit more into your past medical history. I just want to talk a little bit about immunizations.
Yeah.
So, I know you're a new patient here, but we like to make sure that everyone's been immunized. I'm just going to go through a couple of immunizations, and you can let me know if you've had them,
Mm-hmm.
and that'll be like our start. And then
Yeah.
if you want to get me the immunizations from your old primary care doctor,
Yeah.
that'd be really appreciated.
Sure.
But this way I can just put a general idea.
Yeah.
Have you ever had the diphtheria immunization?
Yes, I believe so.
Okay, what about tetanus?
Mm-hmm.
Do you know when the last time that one was?
I think all three of those were my last Tdap. That was probably about 5 years ago.
Okay,
So before
good.
I retired, I know I needed to boost that one.
Right, because I was going to say, I'm sure you know this being a nurse, but
Yeah.
they expire 8 to 10 years, so I'm glad that you're still covered for that for now.
Mm-hmm.
Have you ever had the polio vaccine?
Yes.
And what about the MMR, measles, mumps, and rubella?
I did get that with all the measles outbreak stuff coming out.
I know.
I couldn't remember when my last one was, so I made sure I redid that one.
It's always a good idea to get re-immunized.
Yeah.
What about influenza, flu shots every year? I know it's kind of early in the year to get your flu shot, but...
I do need to still do that this year.
Okay,
Yeah.
well, we can give that to you at the end of our visit today if you would like it.
Sure, yeah.
And what about varicella?
No, I had chicken pox.
Okay, have you heard that there's a new shingles
Yes,
vaccination?
I did.
Have you
Mhm.
gotten that yet?
I have not. There's a wait at the pharmacy, like all over the place. I feel like it's hard to find, but
Okay.
I'm on a waiting list.
Okay,
so,
good. And
yeah.
I can counsel you a little bit more about that and, what that vaccine will hopefully help.
Yeah.
So we can talk about that a little bit later,
Definitely.
too. Have you ever had the hepatitis B vaccine?
No, I don't think that I have.
Okay. And what about pneumococcal?
I think this year I'm ready for that one. I think I need that one boosted.
Okay. Once we can do titers and we'll see. And once I get your immunization record from your old primary care, then that'll help us get a better idea of that.
Sure.
Have you ever had your HPV vaccine?
I don't think I ever have. No.
Okay. So that one screens for cervical cancer.
Mm-hmm.
It's a human papillomavirus is a virus that you get from sexually from having sex, and basically we've noticed that virus can turn into a cervical cancer. So it's a super important thing that we recommend usually younger people to get, but I don't think it's ever too late to get it, just to help protect yourself.
Yeah, I remember when they came out with it. Yeah.
And then for just screening tests for your overall health going along with immunizations, have you ever had a TB test done? I'm sure you have, being a nurse, but...
Yeah, I did. Probably the last one was a couple years ago, so right before I retired, I think.
Right.
Yeah.
And has it ever been positive for TB?
No.
Okay. And have you said you've had a pap smear, but we haven't had it in a couple years now that you've gone through menopause. So we don't have to talk about that anymore, though. We've talked a lot in depth about that.
Yeah.
Have you ever had a mammogram done?
I have. My last one was probably like 2 years ago, so I might be a little behind, but
And was it normal then?
it was normal.
Okay,
Yeah.
good. And have you ever had a colonoscopy done?
Oh yes, they're awful.
Yeah, I can't speak for them. I've never had one, but from what I hear, patients do not love them. Was your colonoscopy normal?
It was normal. Yeah.
Okay, good. And did you know, since you really don't like colonoscopies, because who does, there's this new test out too called the fecal occult blood test,
Mm-hmm.
which kind of does the same thing as a colonoscopy, but instead you send, this might sound a little gross too, but you actually send a stool sample out, and they
Okay.
can test through diseases that way, so you don't have to go through the whole process of a colonoscopy. If you maybe want to try that next time.
Yeah, I'll add that to the list, so I won't have to do that again.
And have you ever had your cholesterol levels checked?
I have. I usually try to do that every year,
Good.
especially with my high blood pressure. I like to keep tabs on how my cholesterol is, just to stay healthy.
Yeah, I like that you seem very proactive in your health, and that's really important. I just want to talk a little bit about your family history.
Mm-hmm.
This is going to go kind of far back, but for your paternal grandfather, so your dad's grandpa, can you tell me a little bit about his health, what year he died, or if he's still alive?
He passed away. I think he was 77. I think he had a heart attack. Other than that, I don't know anything else about his health.
Okay. And what about his your paternal grandmother?
Yeah, she made it to I think she was 88.
Oh wow.
She had dementia, I know that, but nothing else comes to mind that she had. So
good. And what about your maternal grandfather?
He passed away when he was 55. It was a boating accident.
Oh, I'm so sorry to hear that.
Yeah, I can't think of any health issues he had, but yeah, died too young.
And what about your maternal grandmother?
She made it to 93. I know she had high blood pressure too, like I do.
Seems like you got some good genes in the woman in your family.
Mm-hmm.
How is your dad doing? Is he still living? Is he healthy?
He passed away when he was 72. He had a heart attack as well.
Okay. And then what about your mother?
My mom's still alive. She has hypertension, and she has diabetes as well.
Okay. And how old is she?
She forgot to add this up. She's 89.
Perfect. Well, I'm glad to see that for 89. She looks overall pretty healthy for only having some high blood pressure and some diabetes.
Yeah.
And do you have any siblings?
I do not.
Okay. And I know you have your one son.
Mm-hmm.
What's his name again?
Sam.
Sam. Okay. And Nancy, how's Sam? He's 40, and you said overall healthy. Does he have any other conditions?
No, he's healthy other than that.
Okay.
Mm-hmm.
And so sometimes when we talk about family history, people forget about a lot of things and just don't think to mention them because they seem so minor. Sure. I'm just going to run through any of these, and if it sparks that you remember someone in your family had it, just let me know.
Sure.
Any headaches?
No.
Seizure disorders?
Mm-hmm.
Stroke?
No.
Mental illness?
No.
Suicide?
Nope.
Substance abuse?
Mm-mm.
Thyroid disease?
Nope.
Coronary artery disease?
Just the heart attacks, but...
Right, with your dad and grandfather, right?
Yeah.
Okay. I know hypertension runs in your family.
Mm-hmm.
I know you get your cholesterol checked, but any elevated cholesterol levels?
Not that I know of, no. I mean, I'm sure with the heart attacks, maybe they had an issue. I don't know for sure. But...
Right. And diabetes, I know you said your mother. Anyone else?
No, I think it was just mom.
Okay. Any asthma or lung disease?
No, not to my knowledge.
Good. Any tuberculosis?
Nope.
Renal disease?
Nope.
Any arthritis? I know you might have arthritis.
Yeah, I don't know if anyone else has ever had that, but I certainly do.
Okay. Any allergies?
No.
Sorry. Any cancer history?
Not that I'm aware of, no.
No ovarian, breast, prostate, colon, lung cancer?
No, I don't think so.
Okay. And any genetically transmitted diseases, so any cystic fibrosis or things like that?
I don't think so, no.
And then, I know I've asked you this before, but you said that no one really had similar symptoms as...
Yeah, I don't think so.
Okay. And then I just want to talk a little bit about your social history because I want to get to know you and you as a person, not just you with your complaint.
Yeah.
So, where were you born?
I was born in southern Delaware.
Oh, okay. Did you like growing up there?
Yeah, I was happy to get out too, though, you know.
Yeah, just time for a change of pace, or was there something that you wanted to get away from?
Nothing I wanted to get away from. I just wanted to live near a city. So,
yeah.
You know.
Do you like it here so far?
Yeah, I do. Yeah, it's been good. We've been here for a long time.
Yeah.
So, yeah.
Oh, that's so good. I'm glad you like it. I love it here too.
Yeah.
I feel like I've been a lot of places, and it's definitely one of my favorites.
Yeah.
If someone asked you how your childhood was, what would you answer with?
Oh, it was great. Yeah, I love my parents. I wish I had siblings, but had a lot of friends in the neighborhood, and yeah, it was great.
Yeah. Would you consider it a typical, childhood? You got to play with your friends. You got the chance to be a kid.
Yes, definitely.
Good. And I know you're a nurse, so was that your last year of schooling completed too? Was your bachelor's
yes.
degree?
Mm-hmm.
So what year was that?
It was 39 years ago.
Okay. And I know you're a nurse. Did you have any other jobs though?
No, I mean now I volunteer, but when I was working, it was just mostly in the hospital. And
yeah, nurses don't have much time to do more than one job. But
I mean, I was a waitress to get me through school, way back when. But
and then for your home situation,
mm-hmm.
Is it just you and your husband in the home?
It is. Yes.
Do you have any pets?
We have 3 dogs, yes.
Oh, 3 dogs? What are their names?
Charlie, Henley, and Maddie.
Oh, those sound like cute dogs. In your house, do you guys have stairs?
We have one small flight of stairs, but the bedroom is downstairs, so.
Okay, so it's not too much, because I know your joints hurt. It's okay.
Mhm.
You can get around your house okay?
Yeah, it's really just if I need to get something in the guest room, but typically I don't need to go up there, so.
Okay, good. And I know you said that your relationship with your husband was great.
Mhm.
Do him and you both always feel safe in your house? And okay,
Yes.
and
Especially with the dogs, you know.
yeah, they help. Do you have any sources of stress?